The following is a paid presentation for spinal decompression therapy, a non-invasive, non-surgical treatment for back pain.
I'm Dr. Luke Henry, chiropractic physician, and if you're one of the millions of Americans who suffer from neck or back pain, the next 30 minutes could literally change your life for the better. You're going to meet people just like yourself who had tried everything from physical therapy, chiropractic, medication, injections, or even surgery, and were still suffering from chronic pain.
The pain I had stemmed from, the sciatic, and it was excruciating. On a scale of 1 to 10, when it first happened, it was about an 8 or a 9. It was searing.
At the worst that it's ever been in my lower back, I could only walk about 100 yards. I would have to sit down and rest, and I would actually be dragging my right leg behind me.
My pain was a shooting pain down the back of my legs and in my lower back. I couldn't walk without being in pain. I couldn't sit. I couldn't bend over.
But they all discovered what you're about to discover, a new technology called Disc Force non-surgical spinal decompression that can help to significantly reduce or eliminate chronic pain. The treatment is so gentle, the patient lies down on their back and a computer gently distracts the spine to free up the pinched nerves and alleviate pain.
Disc Force is a revolutionary new equipment. We couldn't do without it in my sport, I don't believe.
I was 500% better than I was just 1 week earlier. There's no way that in 1 week that I would have been feeling that much better, so I knew that the only difference could have possibly have been Disc Force.
I think anyone with back pain and living in an environment where your life is limited because of back pain, you are looking for that hope, you're looking for that answer, and Disc Force provides that answer.
People who are suffering from back pain now, they cannot afford not to use Disc Force. They can't afford to lose the quality of their lives. And if they want to lead a normal active life, then they really need to get in and use Disc Force, because it's going to help them, and it's going to make their life the way it was before, and maybe even better.
Disc Force is so gentle and so relaxing that most patients look forward to their therapy, and many patients fall asleep during the treatment. If you're suffering from pain from a herniated disc, bulging disc, degenerative disc disease, sciatica, or facet syndrome, you owe it to yourself to find out if this new technology can help you, like it's helped so many other Americans to lead more active and pain-free lives.
Jeff Amy is a recently retired school teacher looking forward to a life doing the things he likes to do most, spending time with his wife, working in his yard, and playing golf. Jeff was relatively healthy, with the exception of a few aches and pains in his back. Little did he know, the aches and pains were warning signs of a more serious problem that came to a head as Jeff arrived for a golf tournament.
I was trying to get my golf bag out of the trunk to play in the golf tournament, and it took me 5 minutes and I couldn't get my golf clubs out of the trunk.
Jeff actually fooled himself into believing the back pain would subside. Instead, the pain became so severe, he spiraled into a state of depression.
At that point, I felt like I need to do something. I started on medications. I went to a psychiatrist and he put me on several medications, and that helped my depression, but it didn't help my back.
Jeff met with many different doctors, and he was diagnosed with 2 herniated discs, bulging discs, and spinal degeneration. And while surgery was suggested, there was no guarantee it would alleviate the pain.
I started doing a lot of research. One of the things that caught my attention was spinal decompression and the Disc Force. And at that point, as I investigated it, I thought, before I go in for surgery, I need to give this a try. And I'm just very excited and very happy that I went into it.
After a series of treatments, Jeff is back, enjoying retirement the way he'd always envisioned, spending time with his wife, working in his yard, and playing golf as well as ever.
I played in the club championship, senior championship, 2 weeks ago, and shot 66 my first round, and it felt great. Then I won in a playoff with the birdie in the first hole, and the owner of the club came up to me and said, "Jeff, that was one of the prettiest swings on that first extra hole." And I was just thinking to myself, if you only knew where I was, 6 months ago, I wasn't going to rejoin the club, because I told my wife I didn't think I was going to play golf again.
How do you know if the Disc Force spinal decompression system will work for you? Well, if you've been told that you have any of these conditions, a herniated disc, bulging disc, degenerative disc disease, facet syndrome, sciatica, or general lower back pain, there's a likely chance that Disc Force could help you like it's helped so many others with similar conditions. If you're watching this program, there's a Disc Force doctor near you. And if you're a back pain sufferer, now is your opportunity to reach out and ask for a consultation. You may well find the relief you've always wanted, and it's just a phone call away.
If you're watching this program, there's a spinal decompression center featuring Disc Force in your area. To find out if you're a candidate for this non-invasive, non-surgical treatment, call the number on your screen now and take the first step to living a pain-free life. With Disc Force treatment, you could discover the same pain relief professional athletes and everyday working people have found.
If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural, an injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Eliminate back pain. Eliminate neck pain. Enjoy pain-free living again. Call the number on your screen now to find a Disc Force in your area. When superstar athletes, past and present, seek medical attention for back injuries, knee injuries, and more, they seek the counsel of Dr. Timothy Kremchek. Regarded as one of the top orthopedic surgeons in sports medicine, Dr. Kremchek is the medical director and chief orthopedic physician for Cincinnati's professional baseball franchise and works with other sports franchises ranging from minor league baseball to soccer. Dr. Kremchek knows firsthand the risks back surgery presents.
I've had back surgery. I had back surgery when I was a young resident in orthopedic surgery, and my back has been a problem ever since because of the surgery. And it's something that I wish I could have turned back. I wish I would have had the spinal decompressor back then that would have worked. I didn't. And so now I'm paying for it for the rest of my life.
Now a staunch advocate for Disc Force and spinal decompression therapy, Dr. Kremchek suggests exhausting every alternative possible before opting for back surgery.
Back surgery, the risks are enormous. Things that go on and potentially can go wrong with back surgery are enormous, and they're lifelong. So anything that you can do non-operatively has got to be your first choice, second choice, and again, multiple choices after that. Spinal decompression takes the disc from protruding and brings it back into its normal position and takes the pressure off the spinal cord and the nerve roots. Therefore, it takes a lot of the pressure and the spasm off of the musculature in the lower back, increases the range of motion, decreases the pain, and hence increases your function to do whatever you want to do. If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural, an injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Barry Larkin, the longtime shortstop of the Cincinnati Reds, turned to spinal decompression as an alternative to possible career-ending surgery.
My cervical C5, C6, I had some degenerative disc issues, so the disc have a certain amount of space between the two. My space was very limited, and the disc material that's between the two vertebrae, it leaked onto my nerve. I was almost completely paralyzed. So I go in, have surgery, and then the doctor says to me, okay, fine, now you're good for right now, but there's going to have to be some aftercare. So you're going to have to do something. You can have surgery yet again. The second surgery will be to fuse the vertebrae together. With the fusion, they said you probably lose the mobility in your neck, and I don't know if you'll be able to play shortstop anymore. Or you can do something called decompression therapy.
After consulting with Dr. Kremchek, Barry decided spinal decompression therapy would be the best and most effective treatment.
Physically, I could really feel a difference. I didn't have the spasming, the tightness. I used to have to sleep sitting up. I could lay down. I could lift my kids with no problem. I went back to spring training the next year and saw the doctor and the staff, and they couldn't believe what shape my neck was in. And I played another 4 years. I had another great 4 years. I chose not to have the surgery. I'm a walking billboard saying that decompression therapy works.
Dr. Eric Kaplan is a best-selling author and business leader. He is former president and COO of Complete Wellness Centers and currently writes for Sports Illustrated. Dr. Kaplan's books include Lifestyles of the Fit and Famous, Dying to be Young, and The 5-Minute Motivator. He has served as an advisor to the President's Council on Physical Fitness and Sports and has worked with numerous professional athletes, including players from the PGA and LPGA. He has now used his over 30 years' experience to develop the Disc Force Spinal Decompression System. How does Disc Force relieve chronic pain?
Chronic back pain is an epidemic that's sweeping America. It's actually the #1 cause of disability. It's estimated that over 40 million Americans, 1 out of 3 people, suffer chronic neck or back pain. The spine is a uniquely simple yet complex mechanism. In between each one of these vertebrae is a disc, which is made of nucleus pulposus and annulus fibrosus, but let's say fluid to make it simple. And as we're younger, these discs actually have more water content. The more water content, the more flexible. As we age, though, from constant compression, from these vertebrae moving up and down repeatedly, the fluid starts to diminish. As the fluid gets displaced, what happens is we develop areas, what we call herniations. Herniations can then rupture. A rupture then would put a trap to the nerve. The result, terrible pain. Sometimes you could have pain, back pain, neck pain, pain down your leg, pain down your arm. What we try to do with decompression is actually open up the vertebrae and allow that fluid to seep back in, which relieves the pain naturally, gently, effectively, not surgically.
Why do you feel Disc Force is a superior decompression system?
Disc Force has revolutionized the technology that doctors are utilizing in their office. What decompression therapy can do, it's a gentle way of opening up a segment. Years ago, they would put a person maybe in a hospital, they would put traction on them, hang these weights at the end of the leg, and the nurse might come by every hour, how are you feeling? Now, through technology, through computers, actually, Disc Force has specific mechanisms that can go by vertebrae, by the patient. We can actually target which vertebrae, which specific vertebrae, and by doing that, what you can do is create a gentle, non-invasive approach to pain relief.
Disc Force, first of all, it was so relaxing. I'd come in here after a day of work and I would literally be able to relax for the first time and almost fall asleep.
I became what they call the napper. I fall asleep on the machine and it still does its job, which is great.
It just feels like somebody's just pulling on your legs, and there's just a little pressure in your lower back. Other than that, it's very comfortable.
It just feels so good and nice. You actually look forward to it, and it's like, on days I know I'm coming to get my therapy, I actually, psychologically, I wake up with a little bit more like, yeah, here it comes. I know I'm gonna feel good today.
If you have back pain and want a non-surgical, drug-free way to end the pain now, try Spinal Decompression on the Disc Force. It's helped thousands of people get past the pain and get on with their lives.
I think anyone with back pain and living in an environment where your life is limited because of back pain, you are looking for that hope, you're looking for that answer, and Disc Force provides that answer.
Call Dr. Henry and try Disc Force today.
If you're suffering from neck or back pain right now, this is your chance to find out if you're a candidate for Disc Force Spinal Decompression.
If you're watching this program, there's a Spinal Decompression Center featuring Disc Force in your area. To find out if you're a candidate for this non-invasive, non-surgical treatment, call the number on your screen now and take the first step to living a pain-free life. With Disc Force treatment, you could discover the same pain relief professional athletes and everyday working people have found.
If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural, an injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Eliminate back pain, eliminate neck pain, enjoy pain-free living again. Call the number on your screen now to find a Disc Force in your area.
And here's how the Disc Force Spinal Decompression System works. The patient lies on a table and a belt is attached to the waist. And the belt is controlled by the Disc Force software program, which is individually customized according to the patient's condition. It will gently pull on the torso, relieving pressure on the disc and allowing the body's natural healing process to go to work. The Disc Force Decompression System is unique because it can actually target individual discs in the spine by adjusting the angle and the amount of decompression.
When I first went on the Disc Force, I was very impressed by how smooth and how fluid the Disc Force machine was.
I didn't feel a thing. I could have just fallen asleep.
I didn't feel anything. When I got off of it, I felt even better than I was.
Like many professional golfers, Greg Owen has struggled with back pain even after surgery. After turning to Disc Force, Greg is now on the road to recovery.
I had back surgery in May 2004, and it didn't really do what I really wanted it to do. It relieved the pain, but the problems were still there. I just found that I couldn't practice, so my game was going downhill rapidly. I come to see from Disc Force. 2 or 3 months, I'm back up to full practice. Being on the PGA Tour, there's no way you can compete with those guys without putting a lot of hard work in, so I know that this is definitely adding to the longevity of my career. My game is very strong now. It's only a mental problem I have, not the physical side.
Not only is Greg able to spend more hours on the range fine-tuning his game, he's able to spend more quality time with his daughter and participate in her activities.
My personal life has got a lot better. I've got a little girl who's nearly 5 years old. I can carry her around on my shoulders. I can play the games that she wants to play. So it's my game's great. My practice is going well, and Disc Force is the best machine I could have to give me a normal life and compete on the PGA Tour.
Are you tired of living with back pain? Has surgery not provided the success you'd hoped for? Are you losing sleep and missing out on the activities you enjoy doing most due to your back? Now is your chance to see if you're a candidate for the Disc Force Spinal Decompression Therapy.
If you're watching this program, there's a Spinal Decompression Center featuring Disc Force in your area. To find out if you're a candidate for this non-invasive, non-surgical treatment, call the number on your screen now and take the first step to living a pain-free life. With Disc Force treatment, you could discover the same pain relief professional athletes and everyday working people have found.
If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Eliminate back pain, eliminate neck pain, enjoy pain-free living again. Call the number on your screen now to find a Disc Force in your area.
Dr. Gerald Mattia is one of the leading spinal decompression experts in the country. Dr. Mattia is president of the International Chiropractic Association Council on Fitness and Sports Health Science. Countless professional athletes have called upon him when back pain has threatened to sideline them from the sport they love. Athletes you've seen on this program, like Johnny Damon, Barry Larkin, Greg Owen, and Dwayne Clemens. Dr. Mattia, could you please explain how Disc Force helps your patients with their back pain?
What decompression does, it opens up the lower back so that the disc, this little herniated disc right here, as we pull it open, it will allow this disc to go back into the center and the pressure will come off this nerve. When pressure hits this nerve, it causes all types of pain in patients. Some patients have pain in the gluteal region. Some patients have pain going down the leg. We have found a way now to prevent all this from happening. As we open it up and allow that to go back into its proper position, the body's own healing mechanism then will take over. The nerves will heal themselves, and the nerves which control the muscles allow the muscles to go back to their normal function.
What do you say to patients who may be considering major surgery or prescription painkillers, or who may have given up altogether?
Well, I try to explain to patients that times have changed. You know, we already know historically with surgical procedures, they don't always work. We want to let them know at least they have an alternative to try something else. Now, in my mind, why would somebody take that route first without trying decompression therapy? If decompression therapy can prevent you from having back surgery or living on medication the rest of your life, my God, how great is that? Right now, Disc Force is probably the finest decompression machine on the market. And I've had some good machines in the past. The results now, my patients are telling me, 9 out of 10 say they feel much better on the Disc Force than they did on the other equipment I used in the past.
Athletes from all sports seek the counsel of Dr. Mattia when it comes to spinal decompression therapy. And with Disc Force, Dr. Mattia keeps them on the field and off the disabled list.
I knew I needed to jump on the Disc Force machine. My low back was really jacked up, and I know this is something that can actually help me out and get me back on the playing field and staying there?
All my career, I've tried to find the best chiropractors, the best doctors, the best therapies, modalities, and I'm into technology on a level that most athletes aren't, because I've always been so serious about my body because of my injuries. And, you know, when I found out about decompression, I looked around and there was still nothing else compared to it. So without this, I don't think I would have been able to play 10 years in the NFL.
The Disc Force is a great decompression machine where it lengthens out my back because somehow I jammed it, whether it was sliding or diving for a ball or all those swings we take during the course of the day. So the fact that I can come here, do whatever I need, whether it's my back or my neck, and it gets me ready to play.
So for me, you know, it just changed my life and, you know, gave me my career and gave me the longevity. And I think the quality of life that I'm going to want later on in life when I'm, you know, in my latter years.
You don't have to be a professional athlete to suffer from severe back or neck pain, but as you've seen, Disc Force spinal decompression therapy has helped back pain sufferers from all walks of life to find incredible relief. Don't continue to live with back or neck pain when help may be only a phone call away.
If you're watching this program, there's a spinal decompression center featuring Disc Force in your area. To find out if you're a candidate for this non-invasive, non-surgical treatment, call the number on your screen now and take the first step to living a pain-free life. With Disc Force treatment, you could discover the same pain relief professional athletes and everyday working people have found.
If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural, an injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Eliminate back pain, eliminate neck pain, enjoy pain-free living again. Call the number on your screen now to find a Disc Force in your area. Teresa Fontaine lived an active life. She enjoyed playing golf with her husband, taking walks and working out. But years of athletic endeavors, such as playing basketball and baseball and competitive high jumping, took their toll on Teresa's back and neck.
When I would turn my neck and look around, I would kind of describe it as Rice Krispies. It's kind of what you hear in my neck. It's what you would hear when you turn your head. And then every now and then I would go to turn my head and it would actually catch. As for the pain in my back, I get a really tightening sensation in my lower back, and then it comes through the lower back, across the hip, and then down the thigh and into the knees.
Everyday tasks that we take for granted, that we don't even think about, became intense, painful experiences for Teresa.
At the worst that it's ever been in my lower back, I could only walk about 100 yards. I would have to sit down and rest, and I would actually be dragging my right leg behind me.
Even sleep became a painful and challenging event.
You lay on your back and all of a sudden you can't get comfortable. You try to maybe roll on your side to relieve the pain, and then trying to shift your feet around, trying to get it someplace comfortable, trying to sleep with the bolsters under your legs. You can't. I mean, you might be able to nap for maybe 30 minutes. You know, you're lucky if you sleep for an hour, you know, and then you're up walking the floors because you're in pain and you're up the rest of the night.
With walking and sleeping and something as simple as turning her head becoming increasingly more painful, Teresa's golf pro introduced her to spinal decompression and Disc Force.
Within 6 treatments, I was back to normal again. Disc Force is going to help you get through the pain and help you get back on with your life.
Don't lose another night's sleep due to pain. Call today and see if you're a candidate for Disc Force spinal decompression therapy.
If you're watching this program, there's a spinal decompression center featuring Disc Force in your area. To find out if you're a candidate for this non-invasive, non-surgical treatment, call the number on your screen now and take the first step to living a pain-free life. With Disc Force treatment, you could discover the same pain relief professional athletes and everyday working people have found.
If I have a patient that comes in, I don't care who they are, and they've got back pain or neck pain, before I would ever recommend that they had a surgery, a surgical procedure, an invasive procedure, even an epidural, an injection, I would recommend the Disc Force because there's no downside to trying this, and it works.
Eliminate back pain, eliminate neck pain, enjoy pain-free living again. Call the number on your screen now to find a Disc Force in your area.
Since I've been introduced to the disc force. It's something that any patient that I have with neck pain, limitation of motion, lower back pain, even pain that radiates down the leg, I will have them consult with a specialist and see if they're a candidate. Most patients are candidates. It helps most patients, and there's no downside to it. The downside is if it doesn't work, which is very few, there is none. Rather than a surgical procedure, if it doesn't work, you can be having a lifetime of misery and pain. And with the results of the decompression, chances are you won't need any type of intervention surgically, which will not only save you time, but get you back out doing the things that you want to do.
Imagine being the loving father of 2 small children, having the ideal career, enjoying life, and having it all change just by bending over to pick something up. That's exactly what happened to Michael Kelly.
I was literally in the airport. I was sitting in a chair. I reached down to get my cell phone, and it literally felt like somebody snapped my back in half. The pain I had, it was searing. I had 3 basic push points, one in my hip, one in my calf, and then one in my ankle. The injury I had were 2 herniated discs and an annular tear. And as a senior executive with a golf management company, part of my job is to entertain clients on the golf course. If I can't partake in that, if I can't travel, then there was a good possibility that I was going to have to do something else within the organization. And it was very stressful. I couldn't put on my clothes. I couldn't bend over to brush my teeth. I couldn't play with my kids. That period of time where I couldn't play with them and I couldn't be involved in their activities was probably one of the worst things that I've ever gone through. Because being a father is being involved and playing with them and tickling them and throwing them on the bed. Just the simple things, and not being able to do that. And then watching Steve and Blake and Bob and those guys having fun with their kids, and they're playing with my kids because I'm sitting on a chair in my driveway. It's terrible. But at no time ever was it uncomfortable. And when it was finished, you were able to stand up and actually feel a relief from the pressure of the vertebrae pushing together. And when the disc force started to take its effect, slowly we're starting to get back parts of our life that were fun. Within 2.5 months, I was right back in the saddle again. I just got back from the Bahamas last week playing with some clients down there. We landed a contract in the Bahamas. I'm able to travel. Things are going good again. Family life is great. My kids and I are able to play. I couldn't be happier.
If you're suffering from back or neck pain and would like to learn more about disc force, call the number on your screen now. This is the one phone call that can improve your life, return you to the activities you love the most, pain-free. Pain relief is just a phone call away. Thanks for watching. And for those of you who are still suffering from back and neck pain, what are you waiting for? Now's your chance to join the thousands of Americans who have found relief through decompression therapy and are living happy, pain-free lives. Call today.
If you have back pain and want a non-surgical, drug-free way to end the pain now, try Spinal Decompression on the disc force. It's helped thousands of people get past the pain and get on with their lives.
I think anyone with back pain and living in an environment where your life is limited because of back pain, you are looking for that hope. You're looking for that answer. And disc force provides that answer.
Call Dr. Henry and try disc force today.